everyone. So today we are here to have a little bit discussion about our systemic examination of the full body. Okay, so we are going to start from the head, and whenever we are going to assess the head, okay, before that we want to have a look on the instruments. Can you show here? Okay, so in this assessment of head to neck, we are going to use the stethoscope. As you all know, we have to palpate and hear the bruits which are there in your carotid artery. For that we require, and we have taken two types of these tongs. So these are taken for your ear assessment. When we will be doing the ear assessment, we have to vibrate those and we have to perform it on the patient. Okay, then this one is the otoscope. As you all know, I have covered in the Zoom session that we are going to go for the ear assessment with the otoscope, as we are going to look with the a camera inside the patient's tympanic a cavity we are going to look for. Okay, then this is the knee hammer. As you all know, we are going to check the reflexes from this knee hammer. So for that, for tapping on the tendons, we are going to assess the reflexes. Okay, then when we are going to perform the mouth assessment, so for that we require a tongue depressor. So we have taken this wooden spatula so that we can pat the tongue down so that we can assess. Okay, and in places where we require a flashlight, so we are going to take the flashlight so that we can visualize the cavities. Okay, so now you can look after the whenever the person is coming to you for the assessment. First, we are always going to go for the head. So as you all know, we are going to look for the skull. So all of you know the skull will be having a normal symmetry. It should be round, it should be normocephalic, as the face of the person and the patient's body, or the person's body, it should be normal, it should be round. Okay, so we have to look for the symmetry of the skull. First thing. Okay, then on the skull area, whatever thing we got the hairs. So we have to look for the consistency of the hairs, whether this is the thick consistency, whether it is the thin consistency, whether hairline is going backside, okay, or whether you are able to see any dandruff in this area, or from outside you are going to see the actual consistency of the hairs. Okay, then as you have seen any kind of indentation or any kind of depression in this area, any lesion, any kind of scar in this area. So scar means it indicates that the patient is having any kind of trauma or any abrasion or something is there. So once you have inspected the area for the skin, as the head and scalp region should also be the skin same, it should be of the skin color. Okay, and for any scaliness, any lysis, any pediculosis, so that we have to inspect for. Okay, then as you have completed this, so we are going to wear the gloves so that we can check for the inside of the skin. So you can see the you can see consistency of the hairs here. Okay, so every part of section of the a part is very thick. The hair should be equally distributed in the hair region. Okay, or any kind of a scaliness or dandruff in this area is there or not. So in the every part of the hair we have to see for the any in any area, if the hair is less or any kind of dandruff part is there, so we have to check for that. In the whole area we have to cover like that. Okay, so if any lysis, any pediculosis, or any kind of infestation, any bacterial manifestation can be there can be some lumps, so we have to mention in the notes of the patient. Okay, so once our skull part is over, so now we have to look for the symmetry of the face of the patient. Okay, so what is the normal symmetry of the face? So as we have to see for the normal forehead, as you know, the normal forehead of the patient is looking just below the hair region. We are having the forehead, and in that also we have to look for any kind of you can say less hairs on the forehead, or the forehead is little bit swelled, or any injury part is there, that we have to look for. Then the symmetry of the eyebrows. As you can see, these eyebrows are just above the eyes, and it is just in the conjunction of the nose and the eyes. Okay, that we have to look for. And what we have to look in the eyebrows, we have to look for the proper hairs consistency, whether it is a equal hair consistency, the alignment of the eyebrows is normal. Okay, that we have to see. Then the eyes, as you all know, the eyes is normal. There is no kind of edema, there is no scar on the eye region, there is no redness in the sclera part of the eye, and there is a equal a pupil of the patient, that we have to see for symmetry. And if I'm saying the patient, can you look here? And then if I'm telling saying the patient to look here and here, so both of the eyes are in symmetry, they are moving properly. Okay, so that we have to see. And then after that, what we have to see for? We have to see for the expression of the patient. Okay, so if I'm telling you, if you have to see for the cranial nerves, and you have to see the connection between the nerves and the brain, so what we have to look? We have to see for the movement of the facial you can see muscles. Okay, so if I'm checking the facial cranial nerve, so I'll tell the patient to move little bit. Can you smile for me? Okay, so if the patient is able to smile from both sides, like it is a symmetrical smile, so that means the patient's movement of the facial muscles is normal. Okay, can you puff air in that? Okay, so if the patient's is able to if the patient is able to do it like this, that means both of the side of the muscles are equally using. Okay, so with that, that means the symmetry and the consistency of the facial muscles are normal. Okay, so now when we are going to go for the detailed assessment of the head, as we have seen the structure, we have seen the alignment of the head, okay, and the face, so now we are going for the deep assessment. So the first part which you are able to see in the eyebrow region, as you all know, that is the eyebrow only. So as I told you, they are the alignment of the eyebrows, whether this is present just you can say above the eyes, and whether it is starting from the a bridge of the nose and then it is up to the ending of the eyes or not, okay, or any kind of scaliness or any redness in the area is there or not, so that we have to see. Okay, you can wear the gloves and you can see for any kind of itch manifestation. Itch manifestation means any kind of lice or any kind of pediculosis present in this area. You can see it from here. Okay, then you can palpate the area, any tenderness in this. Are you feeling any pain when I'm palpating like this? No. So if the patient is having any tenderness in this area, we have to mention. We have to mention any kind of you can say infection which can be done by some lices, can be bacterial. Okay, so that we have to mention, right? So after, as I told you, the hair consistency mainly you have to see that whether any alopecia, there is some conditions in which hairs will be removed from the body, so there may be some patches where there will be no hair. Okay, so that we have to check for the alignment, and you can also check the a movement of the eyebrows. Can you pick the eyebrows for me, above? Yeah, so when they are moving, so they are moving together. Okay, it's not like that one eyebrow is moving up and one down. Okay, so that you have to check for, right? Then if the patient's facial muscle is a facial cranial nerve is affected, so patient's face will be looking droopy. Okay, droopy means when there is some Bell's palsy or there is some a facial paralysis of the patient's mouth, so there will be some a droopiness of the patient's eyelid on one side, so it is not there, so we can see it. Okay, then now we are going to do the assessment of the eyes. Okay, so in the eyes, what we are going to look for? We are going to look for the movement, as I already shown you. Now we are going to start from the eyelids. So as you all know, BSc first years, the eyelids which we are able to see, there should be no edema, there should be no lesion, there should be no scar on this eyelids. Okay, and they should be not droopy. So whenever we are going to assess for the eyes, then you are going to see for the eyelashes, there is any kind of manifestation related to the lices, related to pediculosis, okay, or there is any kind of lesion in this area, okay, or it is droopy or not, that we are going to look for. Okay, then after that, eyelids, you are going to also see there is some in this area, in this part, so you are going to see any kind of abnormal swelling, because there is a condition, BSc first year, when there is some cholesterol, cholesterol in the body is increasing, so there will be some kind of xanthema, as we used to say. Okay, that may be present here, that you have to look for. Okay, and whether you have to look for the hairs for the eyelashes, whether they are equally distributed in the both eyes, or the eyelashes curls is outside or inside. Why I am telling you about the curls? Because normally the curls is little bit outward. Okay, if it is inward, that means there will be some infection related to the cornea, or it can infect your eye, because when the eyes hairs are going inside the eye, it will be very uncomfortable for the patient, and it will be very infective to the patient also. Okay, so that's why you have to check for the curl of the eyelid. Okay, then once you are done with the eyelid, so you are going to the part of the eye inside. As you can see, as you can see, the white part of the eye, all know that is the sclera. Okay, and number first, you are also going to see the outer layer of the eye, that is known as cornea. You can see this transparent area of your eye, that is known as cornea. Then this black part of your eye is known as pupil. Okay, so inside the pupil, we are also having the some ring-like structure of the iris also. Okay, then number first, we are going to assess for the conjunctiva. As you can see, this is the conjunctiva we have to assess for. Okay, palpebral and bulbar conjunctiva. So you have to look for the dark pinkish or reddish colored discoloration, but it should not be that much red that it is showing some hemorrhage. Okay, so you have to see there should be no paleness in the patient's eye. Then you can look for the upper eye. Can you put the down eye? So you can see for here also, if any kind of paleness or something is there, that you have to check for. Okay, so if any pale or something is there, so that means the patient is suffering from either jaundice, or if the patient's conjunctiva is little bit pale, so that means the patient is suffering from anemia. Okay, and for the for the jaundice, I told you that if the white part of the eye is little bit yellowish, that means the sclera of the eye is little bit yellowish, yellowish, so it indicates that it is suffering from, the patient is suffering from jaundice, okay? Or if any red color like a discoloration of the sclera is there, that means the patient is suffering from some hemorrhage. There is some kind of like a intraocular pressure is increased, so that we have to look for, and we can go for the glaucoma or some diagnosis we can make with these like infestations, okay? So we have to look for the like now the iris. So as you know, iris is this like what to say ring like structure which is present inside the pupil, so that we have to look for, okay? Then as I told you, you have to see for the corneal opacities, okay? Now what is corneal opacities? As you all know, BSc first years, cornea means the transparent part of your eye, okay? So if with the flashlight if I'm taking, so you can like tell the patient to look in front only, okay? When the patient is looking in front, so you can have a flashlight and you can put the light on the patient's eye and you can see it will shine. Your cornea will be shining, okay? It should not be dull, it should not be opaque, it should be transparent, it should not have any scar, it should not be having any abrasion, okay? So that means your like a cornea of the eye is perfect. Now what is the area of cornea? Where the light is passing from your eye inside and it is going on the retina, okay? So that's how you're going to check for the conjunctiva, you're going to check for the like a iris of the patient, you're going to check for the like you can see cornea of the patient, okay? Now the very important point which you have to discuss is the pupil. So as I told you, BSc first year, you have to look straight, okay? So this is the like a black part of your eye is known as pupil, okay? So it should be round, it should be reactive to light, and it should accommodate. Now for that I will explain you what is the like how you have to see. You can see when the patient is looking in front, so you can see the both of the pupil is in the center and it is looking in the straight, so you can see it is round, it is nice and equal, okay? So now in this like classification or in this like assessment, what we are going to do, we are going to make the patient to look in front, okay? And you have to look like a far away wall, okay? So what I'm trying to do here, that whether the pupil is reacting to light or not, okay, when the patient is looking in front. So I will be taking the like a flashlight like this and I am going to place it in front of the eye, you have to look straight only. I'm going to like put the flashlight like this and you have to note the pupil constriction. Why? Because as I have already explained you that when the patient is looking straight forward, okay, it's very far away. So when the patient, we are suddenly putting a lot of the light in the eye. So what happens? The patient pupil will constrict, okay? And when I'm taking this light away from the eye, so again it will dilate. Why it is happening? Because when the pupil is constricting, because the excess light is going into the pupil, okay? So pupil can accommodate or pupil can react to the light as it is like dependent on the light. If there is extreme light in the room, so it will be remained like you can say dilated only, or you can say if we are like closing the light in the patient's room and we have dimmed the light, okay? So if I'm saying I'm dimming the light right now, so what will happen? The light will be very less in the room, so what will happen? The pupil will be dilating to have the enough amount of light, okay? So what I tried to say here, have the patient look in front and dim the patient's room light, and you're going to take the like a pen light and from side you're going in front of the patient's eye and suddenly the pupil will contract. Why? Because excess light was inside. Now if the patient's other side, again I'm going to assess, patient will be looking in front and I'm going to place this like pen light in front and again this pupil will be constricted, okay? But if the patient's pupil is not constricting or the pupil was again dilated only when excess of the light was inside, so that means there is some problem related to pupil and there is some neurological problem, okay? So that is showing you the neurological problem if the pupil is not reacting to light properly, okay? So that's how you're going to check the pupil reaction to the light, okay? That is number one part. Now you're going to check for the ocular movement. So we are going to assess here two cranial nerves, that is your cranial nerve number ocular, like a oculomotor nerve and the trochlear nerve, okay? So in that what we are going to do, we are going to check the gazing of the patient, that whether the patient's muscles are working fine with the nerves or not. So what we are going to do, we are going to make the patient to look wherever I will say the patient to look, okay? So wherever I will keep this pen, okay, so you have to look like that, okay? So now I'm going to put this pen in the upper side, then in the right upper side. You don't have to move the head, okay? You have to keep your head straight and wherever I'm putting this pen, you have to look, okay? So once again you see, okay, in the left upper side, then in the right upper side, then in the lower side, then in the like other lower side, then in the left side, in the right side, Okay, so whenever I'm doing this, I have to stop in between so that I can see that whether there is any kind of nystagmus. Now you all know what is nystagmus, that whenever the eye movement is happening, it should be equal. There should be no sluggish response. There should be equal movement of the eye, whether it is in the upside or the lower side. Okay, so that's how you are going to assess the muscular function, because every time when you're moving your eye in the left side, right side, or in the left or right side of the patient, so they are telling you that the muscles of the eyes is normal and the cranial nerves of the patient is normal. Okay, if the patient was only able to move one eye or the other eye was in the same a place, so that means the patient is suffering from some nystagmus, or you have to check for the a strabismus. There is one more condition I told you. Strabismus means when the patient's eye is still in this side and it is moving, but other side is upside down, lower, or in this side. Okay, so that strabismus and nystagmus we have to see. And in the pupil, as I told you, both the pupil size is what normal, that is from 3 to 5 mm is normal. Okay, so if the patient's pupil is abnormal in shape, like one pupil is big and one pupil is small, so that condition is known as an escoria. I have already told you, you can go through the PPT again and you can go through that. Okay, so the normal size of pupil should be 3 mm to 5 mm, and during the assessment time you have to look for the sizes. Okay, so once again we have checked for the pupil reaction to the light, then we have checked for the movement of the eyes. Okay, so now we are going to assess the patient's convergence of the eye. Okay, how you have to look for the convergence, everyone. So I'm going to place this pen light away from the patient's face. Okay, and I'm going to make the patient to look at the top of this pen, and then suddenly you have to look the far away of the wall. As you can see, from this area to the wall of the far away you have to look for. So what we are going to assess in this, we are going to assess the accommodation of the pupil. That means whether the patient's pupil is little bit constricted when it is very near away, or when the patient's pupil will be very much dilated when we are going to look very far away. What does that mean? That means the pupil requires only less surface area to look for the nearby object, and it requires more surface area. That means it needs to dilate to look for the far away. So can you see this? Can you see the top of this object? And then suddenly you have to look for this, and again you have to see here, then again, and then here. Okay, and then once again you can check like this. You have to see this, and I'm going to bring it to your nose, so you have to look like this. Okay, so like this. Can you see? Okay, so when I'm making the patient to look at the tip and then the far away wall, so with this the pupil is constricted here and the pupil is dilated when far away. Okay, and when I am taking this a pen light source to the nose of the patient, so again the pupil is constricted, so that the object is very nearby, so there is no need to dilate. Now it will be constricting. So if both sides of these things are normal, that means the patient is able to accommodate very nicely, the patient's movement of the eyes is normal. Okay, and the pupil is nicely round and reactive, and it is accommodating to light also. So we will refer this as the perla. As I already told you, perla means P-E-R-R-L-A. That is, pupils are equal, equal, round and reactive to light, and it is accommodating. Okay, so that's how you have to write it. Okay, then now you have already checked the convergence also with this, when the patient's nose from a patient's pencil or to the nose, when the patient was able to converge. So in that also you can see again the you can see convergence, that when I'm putting eyes here to here, so patient's eyes is able to look the a nearby object only. It's not moving away from the you can say if there is a patient who is having some abnormal convergence, so patient's eyes will be like this. They are going to look like this, but they are not going to look like this. Okay, so this is the normal response of the patient. Okay, then now what we are going to assess, BSc first year, we are going to assess for the visual acuity of the patient. Now what is visual acuity? The ability of the eyes to look for the details of the eyes of the patient. Okay, so what we are going to do is I am going to stand in front of the patient like this. Okay, and I'm going to assess the patient's visual acuity. So what I'm going to do, you can take some. Okay, so now we are going to assess here how to assess the peripheral and the central vision of the patient. Okay, so what I'm going to do here, I'm going to make the patient in front of me with one eye covered. Okay, so just opposite to the patient's eye, I'm going to cover my eye like this, and I'm going to tell the patient to look on my nose. And even I, as a examiner also, I need to look on the patient's eye. Okay, and then I'm going to look on the patient's peripheral vision. Okay, so you can see, you have to see in front of my nose, and I am going to bring the pen like this. Okay, so I'm going to ask the patient that when you got to see first time the object which I'm going to show you. Okay, one side and then again other side. I'm going to this side. You're going to again the patient like will again going to see on my nose only, and from one side like I have already covered, and then from other side we are going to like place the pen, and the patient will tell me that when the patient got to see the first time the object. Okay, so it can be from the lower side like this. So and then from this side. And then again I can use my other you can say hand, and again from above side I will be making this like a pen like this. So when the patient is able to see the first time, okay, so when the patient is able to see first time this object, so that will tell you that the patient's peripheral vision is also working. Okay, so with this the peripheral vision we have to check. So if the patient's lower side of the vision you have to check, so you have to bring like this. Okay, and then when you have to check the upper part, so you will be bringing it like this. So when the patient's upper or lower part of the eye was able to see the object, so that time the patient has to tell me. So with that I will be able to know that whether the patient's peripheral or the central vision is normal or not. Okay, so that's how you have to check the visual acuity number first time. And the other side we are going to check for the like you can say visuals like a patient's like ability to see with the Snellen's chart. Okay, but before the Snellen's chart we are going to assess the patient's like visual power with the like a magazine. So you can take a like a newspaper or magazine, or you are going to keep it nearby like approximately 20 like you can say feet away. So you are going to tell the patient whether you are able to read this. Can you read this thing for me?
Inspect the scalpel, lump, maybe, or other machine.
Fine. So that means when we are keeping this object away from the patient's like you can say like eyes, so patient is able to read it. So that means patient is able to have a normal visual like a power of the patient. Okay. So number first thing we can give the patients like a magazine, okay, and a newspaper to the patient. And then in the second time when we have to assess the patient's visual power, so we can give a Snellen's chart. As you all know, I have shown you the Snellen's chart. So nearby the patient I have to stand the patient like this. Okay, and you can keep the mask like this. So you are going to make the patient stand like this, and away from the patient like 6 feet. Okay, we are going to make the patient stand like this, and like up to here we are going to keep the like a Snellen's chart like this, and we are going to tell the patient to look and read this for me. So if it is very big words, patient will be nicely able to see, and I will be saying the patient whether you are able to see this. The patient will say yes. So that means the patient's like you can say bigger words like ability is like good, he can read it. But up to the point, as I told you, 20 by 20 vision means when the smallest line the patient is able to see here from the 20 by 20, so that means the patient is having the normal vision. Okay, so can you read this line for me?
No deviation and abnormal.
Okay, so when the patient is able to look from this distance to the Snellen's charts, that means the patient's like a visual acuity is by 20 by 20. Okay, and if the patient is not able to read below the 20, that's quite normal. Okay, because that is very small. But up to 20 by 20 the patient should have. Okay, and next when the patient is not able to see the big words also from this distance, so that means we have to go for the other test. Now what are those other tests? Then example, the patient is not able to see these big words in the Snellen's chart. So what I am going to do, at the same distance I will be standing like this, and I will be showing you the numbers of my finger. So can you see these fingers? So if you are able to see that these 5 fingers are there, if he is saying can you tell me how much is this? 5. So that means the patient is able to see my fingers. Okay, or whether you are able to see me, so like that you can tell me, or you can make the patient's finger count, or you can tell anything which the patient is able to see. So that means the patient's little bit like a vision is there. But if the patient is not able to have the 20 by 20 vision, that means we need to have some interventions related to the eyes, and that we need to document it. Okay, so very important point in these eye assessment, as I told you, we are going to assess the perla in this. Okay, so perla means the pupil has to be round, reactive, equal, and it should be like reactive to light, and it should be accommodating. What is accommodating? As I told you, accommodation means from the like a patient's like a nearby object, whether the pupil is like a little bit constricted, and when we are keeping it to the nearby vision, so it is dilated. So whether according to the light and according to the like object, whether it is accommodating or not, so that's how we are going to assess the eyes. Okay, so these are all we have to assess in the eyes. The cardinal movements we have assessed, we have assessed the pupil's reactivity, we have assessed the accommodation, we have assessed the muscular functions of the eye. Okay, so thank you, and in the next video we are going to cover the next part of the assessment. Okay, thank you.